Hello, this is Dr. Appel from Daniel Appel DDS in Oroville, California. And we've had a lot of recent questions on dental fillings, so we're going to take a few minutes to answer some of those questions. What are dental fillings? So dental fillings are a durable material that we use to replace missing tooth structure. The purpose of a filling is to seal out the bacteria, to return your normal tooth shape, to return your normal chewing function, and also to seal the tooth structure up so that we don't have any of the sensitivity that occurs when internal parts of the tooth structure are exposed to the mouth. Can fillings be avoided? Like most everything else that we use on a day-to-day basis, fillings occasionally require some maintenance. However, the vast majority of the fillings that we have to do are related to poor home care as far as keeping the teeth really nice and clean and failing to prevent extreme forces on the tooth structure. So many of the cavities we have to do are preventable. So do your very best at home and minimize the stress you're putting your teeth under, and you will have less fillings. Can dentists do fillings without a drill? Unfortunately, no. Before we can fill a tooth, we have to surgically shape the tooth. One, to remove any fractures or any cavities or whatever the source of the initial problem was, and also to reshape the tooth so it's as strong as possible, what's left. There's really no way to get around using a dental drill to do that surgical work. There was hope initially that lasers might be able to replace a dental drill, but there's some real limitations as to far as what lasers can do for us. So at this point, dental drills are still the best way to get the job done. What are different types of filling materials in dentistry? Probably the most commonly used filling material around the world at this point are composite fillings. Those are tooth-colored fillings. For many years, silver fillings, also known as amalgam fillings, were commonly used, but their use has tapered off as we've seen a lot of advantages with composite fillings. Ceramic and gold fillings were also used extensively for a long time, but they are now very cost prohibitive in their use just as filling material. Can my dental fillings match my tooth color? Absolutely. Fillings have advanced a long ways as far as our ability to match the significant variation we see in colors in people's teeth. So the good news is we can now match them well enough that most of the time when you have fillings, people will not be aware of them for many, many years. Does a dental filling procedure hurt? Receiving dental care should never be a painful experience, period. If you are receiving dental care and you are experiencing discomfort, raise your hand. And if your team does not immediately stop and see what they can do to help you have a better experience, then you need a new dentist, period. There are some very common reasons why we hear stories of people having difficult dental experiences. So we're gonna go over those here for a moment. Probably the most common reason that we hear that causes people to have a difficult dental experience is related to anxiety. It is normal for all of us to feel anxious when we are being worked on around the face. We are programmed to protect that area. So you are not alone if you have anxiety about dentistry. When we have high levels of anxiety, our brain tends to interpret all kinds of normal stimulus, be that a little bit of pressure, a little bit of vibration, certain smells, even certain tastes, as pain rather than the normal stimulus that they are, just based on the high anxiety level of the mind. So the good news is that by reducing anxiety levels, we can provide people with a much more comfortable experience because their brain is no longer misinterpreting those signals. We have a lot of great ways of doing that for people. My favorite is called laughing gas or nitrous oxide. I provide it to my patients for free because it does such an amazing job of helping the patient and the team have a better experience. It's super safe. It's really effective for mild to moderate levels of anxiety, and it's completely out of your system before you even leave the office. So I would highly recommend, if you've had difficult experiences in the past with anxiety or kind of unexplained discomfort during that procedure, to look for a dentist that provides you with sedation options, specifically laughing gas or nitrous oxide. The second most common reason that we hear people having difficult experiences is related to dentists that are doing procedures too fast. Quality dentistry and a good experience take time to provide. There's no shortcuts around it. There's a sequence of things that has to happen in a specific time frame, and you can't cut any corners. Dentists that are in contract with insurance companies have their reimbursement also controlled. And unfortunately, they are generally receiving less than 30 to 60% of what it costs just to provide the surgery, much less pay their bills, pay their team, or even pay themselves. So in order not to go broke, many of them start doing procedures 2 to 3 times faster than they should really be done for optimal quality and for optimal comfort control. I would highly recommend looking for a fee-for-service dentist. This is a dentist that can still bill your insurance for you to help you capture as much of your insurance benefit as possible, but who is also not bound by the reimbursement of the insurance company, and therefore can take the time with their patients to provide optimal quality result and optimal experience, meaning comfort control. Can I brush my teeth after getting a dental filling? Your dental filling, if it's a composite, should be good to go the moment you leave the office. However, I would strongly recommend not chewing anything until you can fully feel all the tissue inside your mouth. You are probably still numb for a couple of hours after the procedure. It's not a good day if you start chewing away on some food thinking it's your hamburger and it's your lip or your tongue or something else. Not a good day for anybody. So wait until you can feel everything inside your mouth before you start chewing on anything. Liquid diet until you can feel everything inside your mouth. Do dental fillings need to be replaced? Yes, we spend a significant part of our day beating our teeth up, and occasionally that means that the fillings need to be replaced after many years of wear and tear. There are a few things that tend to increase the likelihood that those fillings need to be replaced. One is poor health care at home, poor cleaning of the teeth. This will lead to new cavities around the edges of the filling material on the natural tooth structure, which means a new filling. Fillings that are way too large when they're placed. There's a limitation to how large fillings can be before they're not able to support the tooth. Thirdly would be chewing on really dense objects, ice, candy, things like that. Teeth are not designed for that, neither are your fillings. And then the fourth would be not putting something in place to protect your teeth from the clenching and grinding that we all do at night while we're asleep. Whether we're aware of it or not, it's just the way our body responds to our daily stress. And this is what's called a night guard. It's a thin piece of plastic that snaps onto your upper teeth, and we transfer all of that grinding and clenching stress to the piece of plastic, which can be replaced, rather than to your natural teeth, where it creates cracks and fractures and failed fillings and failed crowns and things like that. So those are the primary reasons why we usually see fillings having to be replaced more frequently than the average. How much does a dental filling cost? This really varies on the amount of surgical work that needs to be done to bring that tooth back to a healthy state, and how much damage there already is on the tooth. But I would say you can generally ballpark between $300 to $500 for a tooth until you have the opportunity to have a dentist truly diagnose and give you an exact value. But that would get you in the ballpark for the number of teeth that you think you might need to have fillings on. When should I schedule a dental appointment if I think I need a filling? Yesterday. No joke. Like, dental problems never get less expensive with time. Or to say it a better way, dental problems always get more expensive with time. So the sooner you get that taken care of, the better. So if you are in the Oroville area and you believe you need some fillings, I and my team would love to serve you. Please give us a call at Daniel Appel, DDS 530-533-7545. If you are not in the Oroville area but you feel you need a new dentist, I would highly recommend looking at your local Google reviews. And you want to be looking for two things. One, you'd like to see a number of reviews, not just one or two. You want a broader spectrum of opinions. But secondly, look in the actual reviews and look for clues as to the culture of that office. Is that office kind? Do they communicate well? Do they provide a comfortable experience for their patients? These are very important clues to the culture of that office and can provide an idea of what you can expect from your experience. Hope I answered some of your questions about dental fillings. Have a great day.